લોકોની પાસે છે નંબર.
Jai Jinendra, welcome to the new group of the people over here, and this is a very timely topic for many of us. It has a relevance to our Jain philosophy. We believe it is a 1,000-year-old tradition in India, which is we call Sulekhana, and that has a lot of relevance to what we are doing here in the modern day medicine, which is hospice. I practice medicine for many years, 30 years, and currently I deal with this in a different capacity. I stopped practicing medicine, but I have a long-term care facility where I have a patient who are in a dementia unit. I have a nursing home where there are subacute patients that are on trach, vent, and dialysis. I have about 500 patients among my 4 facilities. And it is an individual choice, but this is the topic that we need to explore when we are healthy and our mind is totally lucid. We need to decide that if we are incapable of making a decision for ourselves, what we would like to have it happen with our body, our belief, and that's what they're going to speak to. And I'm glad that I ran into Hina. She said that she's volunteering at the hospice, and I felt that it would be a very timely topic. And we have a lot of other people, including Dr. Nitin Shah, who is doing a lot of healthcare related work. He's our past president here, and I hope that those who are here would love this topic, would like it, and would put into whatever action that you may feel is appropriate. So I welcome all of you on this Saturday morning, and I thank you very much. Thank you.
Thank you, Dr. Modi. Jai Jinendra, Jai Sri Krishna, Jai Swaminarayan. You're wondering why all these greetings. We not only have members from the Jain Center here today, we have also extended our invite to the Sanatan Dharma Temple. So a very warm welcome to everyone from the Sanatan Temple. For those of you who don't know me, my name is Hina Dhami. I volunteer here at the Jain Center as a Pathshala teacher. Along with Pallavi Bengala, I teach 16-year-old students here. I also have been a volunteer for Evergreen Hospice for the past few years, and just recently I was there, and it just occurred to me that it would be really good for our community to know more about hospice. I sure didn't know before I started volunteering. I didn't even know what it meant. So the next thing was for me to run to Judy, and I'll introduce her shortly. And I said, Judy, would you be willing to do a presentation for us? Our community could use some information. And just instantaneously she said, yes, would be more than happy to. So I'm very grateful to you, Judy. So my next step, of course, was to go to Dr. Jaswant Modi, our president here, and I went to talk to him, and even midway my sentence, when I was saying Dr. Modi, I was thinking about bringing the hospice subject here at the center. He said, I think it's a great idea, and he did that with a big warm smile that he usually has. We appreciate your open-mindedness, Dr. Modi. We're really, on behalf of the community, we are just very grateful to have you as our president. No, I know you're here to listen to Judy Fassett. I won't go on and on. Just bear with me for just a minute. So today we have Judy Fassett. I have known Judy. She's a dear friend. I've known her for the past few years when I started to volunteer there. And she is the warmest, sweetest, kindest person that I know. And I'm not just saying that because she's a friend. The minute you hear her start talking, you will understand what I mean. Her philosophy, her thought process is what exactly matches Evergreen Hospice Care. Starting from the owner of Evergreen, everybody has that mindset of care. Patient at the top of the priority, and patients' families, they bend over backwards to help everybody. And this is not a promotion for Evergreen Hospice, but it wouldn't be fair for me to mention all of that, because after all, Evergreen is the one who has taken the time out of their Saturday mornings, leaving their families and coming here to educate us. So we're very grateful. One housekeeping thing, if we could just take out our cell phones, make sure they're on mute. I'd appreciate. We also have June with us. She works at the hospice. She's here. She has made herself available to answer any questions. So even during Judy's talk, feel free to ask a lot of questions. We have 3 very knowledgeable people here at our disposal to ask any questions that we may have. If there are any language challenges, किसी को अगर अंग्रेजी ना आती हो या ऐसा कुछ हो तो मुझे या तो फिर प्रफुल्ला बिन शाह वहाँ बैठी है, हाथ जरा ऊंचा कीजिएगा ताकि हम आपके पास आएंगे, ठीक है? I was not saying anything bad about you. So everyone here is going to get a raffle ticket. There are, in the emails, we said that there would be 1 raffle prize. To our surprise, there are 5. And I know me personally, I never have the luck to ever win anything. So I always I'm so hopeful and so excited to win, and then I don't win anything, and it kind of breaks my heart into a million pieces. So Judy has taken care of that, and there is something for everyone. So even if you're not a raffle winner, there is a few things actually that Evergreen Hospice has brought for us, each one of us to take. And Prafulla will help you there at the end of the session. You do need to be present here when we're doing the raffle in order to win. Again, thank you, Evergreen. I know that you have worked tirelessly behind the scenes. Thank you, Vivian Tran. How could I forget her? She's also at Evergreen, and she has worked tirelessly to put together all these things for us. So thank you, and without further ado, Judy Fassett.
Thank you, Hina. First, I want to thank everyone for the invitation to speak to you. I'm very honored, I'm very grateful. All of us in hospice are. But on behalf of Evergreen, I'd like to say thank you to the Executive Committee, the Board of Directors, and special thanks to Dr. Modi for having us. And I'd also like to take a minute to especially thank Hina. Hina's very modest, as you probably all know. She's an amazing volunteer. She works with us in the office. She sees patients. There's nothing we don't ask her to do that she doesn't make time to do. She's also taken on quite a big challenge. She's learned to sew since becoming a hospice volunteer, and she creates items for us, for our patients, for their comfort. This is something that makes our hospice a little bit different. I'm not here to talk about specifically Evergreen today, but I do want to let you know that because of volunteers like Hina, we do have some very unique and special things that we do for our patients that provides them with that little extra dignity and level of comfort. We have 75 volunteers like Hina, so we're tremendously grateful. I do want to introduce my colleagues once more. This is Vivian Tran. Vivian Tran is in volunteer management, and she started off with us as a volunteer in her junior year of high school. And I'm particularly proud of Vivian. She and I work together every day. She came to us wanting experience for her college applications. She wanted to be a pediatrician. In working in gerontology with us, she's changed that to she wanted to be a physician in gerontology. And then when she completed her bachelor's degree, she came to me and she said, I love working in volunteer management. Is there a place for me here? And we found a place for her. And we're very, 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 very proud of her. And also, I want to especially introduce June. June is an amazing community education specialist. That is her job. She's an RN, she's a registered nurse specializing in hospice. She's been in this work a very long time. She's compassionate, she's sweet, she's kind, she's soft-spoken. You'll never find pressure in any of this. June can answer any kind of clinical questions you have, anything specific. I am not a clinician, so I'll do my best to answer all of the administrative questions, but June can answer any kind of clinical questions, and she's available to you at any time. If you want her phone number, she'll gladly give it to you, and you can call and consult with her privately if you'd like to. Okay, so I'll go on now, and I want to let you know a little bit about me first. I've been in hospice for over 20 years. I actually worked at a Fortune 100 company in a high-level executive position that, was okay. I enjoyed it. My mother had a sudden massive stroke. Friday night at 6 o'clock she was fine, and Friday night at 10, she really essentially wasn't with us anymore. That's how I came to hospice. That's how I got to know about hospice. We have a small family. It's just my brother and my dad and myself, and we didn't know what to do. We had no idea what to do. Pretty soon in the hospital, they said it's time for her to leave. There's no more we can do for her. What do we do? What do we do with this woman who's taking care of us her whole life? We need her to take care of us. How do we take care of her? And fortunately, we were directed to a hospice, and they came in and gave us direction and guidance, love, support, everything we needed to get through the next 4 months so that my mom had the chance to die with dignity and grace in her own home, free of pain. And there is no amount of money that can repay that. So that's how I came to hospice. I said then, I will be transitioning to whole nother career. I didn't know how I was going to do it. I didn't know how it was going to happen, but I knew that I would be doing that. Then I got breast cancer, and that changed everything again. And after breast cancer, I had become a hospice volunteer myself, like Vivian, and that volunteer coordinator was leaving, and they invited me to have her job. And that's how I got here with you. So I am a very, very strong supporter and believer in the hospice philosophy and what it can do for you, your families, your friends, and your loved ones. Hospice supports all of us, and we're here for you at any time, okay? So now everybody got a little bit of a presentation. I'm not going to do this in reading it, because hospice is a warm organization. We're a warm organization. We care about you. We don't know you yet, but we care about you. We're all going to die. So we know what's to come. We don't know when it'll be, but we want to be here for you. We want to be here for your families. And we genuinely mean this. So while many times you'll see these things in formal presentations, I'm just going to talk a little bit about it. And if I touch on a subject that you're interested in, please feel free. Ask me the question. Between the three of us, I think we'll be able to answer your questions. Okay? So what is hospice? Hospice is a type of care. It's not a location. It's not a hospital. There are a few hospices that have inpatient hospices, but not very many. So patients are provided hospice care in their homes. That's wherever they live. You can live in a mobile home. You can live in your own home. You can live in a nursing facility. You can live in a board and care. Anywhere you live is where we will go to serve you. That's our mission, to serve you and your family and what you need in the way that you need it, within the guidelines of Medicare. We're there for everyone, for the spouses, brothers, sisters, in-laws, next door neighbors, anybody that needs our support during this time, we'll be there for them. It's in a home-like setting because we want you to be comfortable, we want you to be safe and be with your family. We want you to be as comfortable as possible for as long as possible. Hospice philosophy is that you are an important living member of your family and your community until you're not. So right up until that last breath, we're there. And after that last breath, we'll be there if you want us. And Vivian's going to talk a little bit about that as we move on. Hospice care is a Medicare benefit. Now, I just did a presentation somewhere, and the looks on people's faces were similar to some of these I see here. What? Hospice is a Medicare benefit. You're entitled to this. You've paid for this. You've worked hard for this. It is your right. Hospice is your right. If you're 65 years or older, on Medicare. There are other sources to pay for hospice care. There's private pay, there's insurance, Medi-Cal, insurance. There's lots and lots of other ways that can be accomplished as well. But it's important for you to know that you have this right, you've earned this right. Thank you. Choosing to elect a hospice is a very important decision. You're going to have lots of choices when you get there, if you want to select hospice. There's lots of choices of hospices out there. Hospice is for people that have been diagnosed with a terminal illness and their life expectancy, if the current terminal illness would limit their life to 6 months or less. But I have to tell you, lots and lots of people live much longer than 6 months. Right, June?
Yes.
And they do because you take your mom or your dad or your brother to the doctor one day, the doctor says, oh my gosh, there's nothing more I can do for you. Similar to my situation with my mom. What do I do? Well, we're going to help you find that out. But you get taken care of so well that many times your pain is managed better, you eat better, you interact with your families better, and so many times you don't die in 6 months, and that's okay. you don't. There's nothing that says you have to go in 6 months, and you can stay on a hospice service for longer than 6 months. There's criteria to meet, and you'll learn about that if you ever need a hospice. But it's fine. You don't have to go in 6 months. It's very easy to become a hospice patient. You'll go to your doctor, and your doctor will say, there's nothing more we can do. Now you want to concentrate on comfort. So you'll say, well, I saw that lady from Evergreen Hospice, I'd like to call them. And you can call us or any other hospice that you want to, and you can be admitted to that hospice with a physician's prescription or physician's order. It's also your right to know, very important right to know, because when you get to this stage in life, you're startled. When somebody says your mom only, has 6 months to live, there's nothing more we can do, you're startled. You're like, what? It's your right to select your hospice. If you are a member of your supplemental insurance is ABC Company, ABC Company will still be your provider for anything other than your hospice diagnosis. Hospice will be your provider for anything related to your hospice diagnosis. So your medications, your equipment, anything you need. But it is important to know that you can choose your provider at any time. It's a never-ending benefit. It never goes away. There's a term of graduating from hospice. If you graduate from hospice, we're happy for you. We even have a little graduation certificate that we give our patients who graduate. And you go home and you're fine for another year, and then you start to have a little bit of a decline, and the doctor says, well, I think maybe we ought to look into that again. You come right back on. There is no penalty, there's nothing. It is a never-ending Medicare benefit. So what's a life-limiting illness? It can be a lot of things. It doesn't have to be cancer. It doesn't have to be heart disease. It doesn't have to be any one thing. Anything that would limit your life for 6 months, a life expectancy of 6 months, would be an appropriate diagnosis. Again, your doctor needs to say, I think this is where we are, and let us know. And then somebody like June would come out and do an assessment and say, yes, we agree, and we think your mom is appropriate for hospice. Yes, that's true. Yeah, okay. Hospice, again, I've told you, is not a location, so it's important to know that you won't be in the hospital when you are on a hospice service. And most of us don't want to go to the hospital after we've had repeated incidents. I have a family I'm working with right now. Mom is 87, and she's fallen several times at home. So the hospital now has said to the family, really, there's not much more we can do. She's got to have 24 hours care. And so now they're at the beginning of their journey of looking into this. So most of us don't want to go back to the hospital repeatedly. I do want to let you know that hospice means that you have said, do you want to add in? Okay. When you accept hospice, it means that you have said, I understand there's no more curative treatment for you. This cancer is not going to suddenly go away. If it does, and there's a miracle, well, that's wonderful, and we're happy for you. But chances are, you're at your end of life journey.
So I think, Judy, my name is June. I'm just starting to just introduce myself. I've been a hospice nurse for 31 years, and I think the concept of hospice in the past has always been that you're dying, that you are, you are on your end stage of your disease.
In the last few days of life.
Yes, and it has changed a lot because we actually have underused hospice as their benefit. More than overuse because of the thinking. Now, some doctors, especially we have patients that have cancer, when the curative part of their care is no longer able to enhance their quality of life, this becomes to be the next phase of their treatment. So the reason why it becomes to be the next phase of their treatment is not that they're not going to do anything anymore. It's more of being able to deal more with the symptoms that they are having, which is pain management or symptom management as part of their disease progression. it focuses on quality of life. And what quality of life entails is their physical needs, their emotional needs, their spiritual needs, as part of their disease progression. These are things that are going to be changing in their life. And so what hospice can really provide them is that to be able to take care of the patient as a whole aspect of their care. Again, symptom management, comfort, as well as providing support to the family. So when we deal with hospice, not only do we deal with the patient, we also deal with the family. I know it's a very sensitive, very delicate topic sometimes we talk about, but it also is remembering that death is also part of life, and that we also prepare as we have birth, we prepare for everything. We also do the same thing with death, and that is, preparing, be able to not only prepare with the dying process, but also giving them the best quality of life that they could be able to have. And so, and that being said, people always think of when they're being referred to hospice, they always think that the doctor has given up, or their mom has given up because they're not eating. But sometimes what we don't realize is that that's also part of their disease progression. When elder people in their dementia, or if they have cancer, or if they have end stage of their congestive heart failure, that eating or food becomes to be for oral gratification. So it's not really that they're giving up. It's more of they're realizing that they're not getting better, but they're also realizing that their body is not going to be going to get better in the sense of all these treatments. Am I still on? That all these treatments aggressively that they're doing is not helping them. Not helping. Okay, there you go. I can hear myself now. So it's really a kind of care that will benefit patients that are on their end stage of their disease. Also thinking of their quality of life also involves what their wishes are. In the past I know people have prepared what you call an advance directive, which is very important for us to have. Because it also tells our family what we would like to do when we are on that kind of stage, or when we're not able to make any more decisions. That it is very important to respect the wishes of our parents, respect the wishes of the patient, of what they would like to do. Sometimes, because they've been in and out of the hospital, very typical of patients, either with congestive heart failure, or sometimes even with patients that has chronic pulmonary disease, that they go in and out of the hospital because of their disease progression. Now, the advance directive will actually tell us, or tell the family, of what their wishes, the patient's wishes are when they get to that stage of not being able to benefit from the curative part of their care. That this becomes to be the next phase of their treatment, which focuses more on symptom management and, again, quality of life.
Thank you so much, Judy. That was perfect. Perfect.
I just have one also comment. I know that one of my patients actually said to us that her mom has given up. I think my mom has given up because my dad died few months ago. And when we were exploring why, she had said that, actually we told her that, I think your mom was just there because your dad needed that help. And so she tries to hide all the illness that she has. So now that the doctor had said that she has, this is part of her congestive heart failure, that it's not really giving up. It's more of accepting that they're not, that they're not getting better. So they focus on the quality of life that they're able to have. And so we were able to provide care for them. And in fact, it made their quality of life so great that she actually had few more years that she was able to be with her family. And that's, I think, one of the benefits that hospice can provide, is to be able to, again, focus on their symptom management so that they don't have to go back and forth to the hospital because of their disease progression, that they could be taken care of and monitor their symptoms as well. Thank you.
Thanks, June. I also want to talk to you a little bit about what it means to have hospice service at home. It means that every service is going to come to you for your hospice-related illness. You're going to see a hospice physician. Your own physician can continue to follow you if they so choose, but you're also going to be having a hospice specialty physician. We're, as Jude mentioned, we're experts in pain management and comfort care. So that also means that in addition to the physician coming to your home on a scheduled basis, you're going to have assigned to you an entire team. We refer to it as an IDT, which doesn't mean anything to you, but that means interdisciplinary team of members, medical professionals who are going to come and serve you now. You don't have to go to the doctor's office anymore. You can, if you want to, for your non-hospice related illnesses. If you have high blood pressure or you have thyroid disease, you can still go to your doctor and be treated for those things. But everything related to your terminal diagnosis or your end-of-life diagnosis, we're going to come to you now. So you're going to have an RN case manager who's going to oversee your case. And you're going to see that RN case manager from 1 to 7 times a week, depending on what your needs are. I think the average is about twice, 2 to 3 times a week. In addition to that, you're going to have a social worker. And the social worker is going to help your family, as June talked about, get prepared emotionally for the end of life. They're also going to help you with some of the practical things to do with end of life care as well. All the paperwork that has to be done and the advanced directives, and all those things. Those are just realities that we'll need to deal with. But they're going to help you understand emotionally what's going on. They're going to help you with funeral service arrangements, whatever you need, and they're going to be there for support for you. In addition to that, you're going to have a home health aide. That home health aide is a specialist in helping your loved one with their daily living activities. So they can help them take a bath so that they can be nice and clean and comfortable all the time. Our volunteers make beautiful hospital-type gowns for some of our clients who don't get dressed anymore, and they're very sweet and nice. They always look clean and pretty and comfortable. We have volunteers that make blankets that the home health aides take out. They're going to do all that for your loved one. That's going to help you a lot. My mom didn't want my brother dressing her. She didn't want my brother to brush her hair. So these are things that we're aware of and we want to help you with. And this is what these home health aides do. And they do a lot more. They're unsung heroes. And they'll come, again, on a scheduled basis, depending on what your needs are. You also are going to have access to chaplains. If you want a chaplain, if you want whatever your preference is, we're going to provide that service to you. If you don't want any of these services, you do not have to take advantage of any of them. Hospice is not a religious organization, so we don't have an affiliation with anything one way or another. We honor you and what you want, and we're going to provide that for you and see that you get that. And then also, in my expertise, we're going to have volunteers. And I mentioned earlier, we have 75 volunteers. They come out to your home. They will stay with your loved one up to 4 hours so that you can go out. You can go to lunch. You can go to your dentist appointment. You can go to your doctor's appointment. You can go watch your grandchild's school play, so that you know that a Medicare-trained volunteer is going to be there for safety for your loved one. The volunteers are not clinicians. They cannot by law provide medical care or any kind of clinical care, but they are there for safety. They're specially trained on what to do if there's a problem. And we spend a lot of time and effort with training and re-education every year with our volunteers. They'll be there to play games with your loved ones if you want to, if they play cards, to talk. We have volunteers that bring pets for pet therapy. We have a massage therapist, we have a hair cutter, because remember now, mom probably can't get out to get her hair cut anymore. Dad can't probably get out to get his hair cut anymore. These are all volunteer activities that we do. We have volunteers that bake cakes for patients for their birthdays. We always send out a reminder to the staff if it's your loved one's birthday, and we have a little card, a cake, a cupcake, a little gift, something, to honor them and let them know how important they are to all of us. So, should you want to access a hospice benefit, if you say, I think this is for me, I'd like to investigate this, we kind of talked a little bit about it. You're going to talk to your physician, and you're going to ask for a referral to hospice. It's very, very simple.
Judy, may I?
Uh-oh.
We, in addition to that, also we cover any medications or any medical equipment that they will need at home. So if they need a hospital bed, if they need a wheelchair, if they need oxygen, hospice also provide that. We also are available for you 24 hours. You could always call us anytime. I think that's like one of a life alert thing that you could be able to have, knowing that you could always call hospice if there's any symptoms that needs to be controlled, even if it's in the middle of the night, that there's always a nurse who could be able to attend to your needs, especially with regards to symptom management.
Thank you, June. So it's easy to get a referral to hospice, and somebody will come out and say, yes, we agree that your mom, dad, your loved one is appropriate, and then you'll be on hospice almost immediately. There's of course forms to fill out, because there's forms to fill out for everything, but somebody will come and help you with that. They'll guide you through it. You will never feel pressured or hurried. You know, we want you to know what you're signing, what it really means. And as June touched on just now, we are experts in pain management. And in addition to the things we talked about a minute ago, all of your equipment that is hospice related is, bless you, is paid for by Medicare. So if you need a hospital bed, that is paid for by Medicare. Oxygen, all of your end-of-life medications are paid for by hospice. It does not mean that you don't take any of your other medications if you want to continue. You can. That old myth that hospice is going to take away all your medications is not true. You can take all of your other medications. As you progress in your end-of-life journey, you may not want to take those medications anymore. You can let us know, or we might say to you, do you think you're getting ready to want to give those up? And then if you want to, you can stop taking those. But it is an old myth that hospice will come in the last few days of life, make you stay in a bed and take all your medications away. That's not true. That doesn't happen. Again, we want you to live your best life for as long as possible, but we're there when you need us. And again, we talked early on about pain management and the relief that brings, the emotional relief to your family, to your friends, to everyone. Do you have to make any changes to your home when you get hospice? You might a little bit. Your loved one may need a hospital bed, and our staff will help you, or our hospice staff will help you to say, maybe you want to put the hospital bed here or there for convenience. And they're experts at why placement might be important to access your care. So all of that's going to come to you again, as we talked about. And it'll come to you as you need it. Say you need a bedside commode 3 months down the line, and you didn't when you came on, you're going to get it then. Wheelchairs, walkers, anything you really need that's hospice related, we'll be providing for you. And in general, hospice will assist in any way that can make your care more comfortable and safe for you and your family. Hospice payment, we kind of covered that a little bit early on too. Hospice is a Medicare benefit. It's also paid by Medi-Cal. It's also private insurance. It can be private pay. There's lots of options. So don't be afraid to ask, what are my options for that? And there's a lot of people who know very specifically about all that. The first thing that we're gonna do is we're going to find out what your needs are, and then we're gonna try to serve those needs as best we can. Any questions so far, anybody? Hi.
Two questions. We are basically Indian Gujarati Jain community, and we have a specific need for the food. In this hospice care, let's say my wife is all alone, I'm already gone, she's all alone in the house. How she gonna get the food supply? That's question number one. And number two, this auxiliary help, the one who's gonna do the bed, bath and things like that. How reliable that those people are? Because my wife is all alone in the whole house. We are valuable or whatever. And I heard all these bad things happening to the people by the healthcare professional. So can you answer me those?
Well, that is an amazing question, and that's the one we all worry about for our loved ones. And the answer is not as simple as 1, 2, 3, but I'm gonna let June talk about it a little bit because this is her area of expertise. But I can tell you that there are systems and people in place to help you with all those choices and all those changes that'll be coming. And I can't speak for every hospice in the world, but I can tell you that at our hospice, dependability is the number one thing. It's very important. So go ahead, June.
Sir, first of all, with regards to food for oral gratification, we continue to acknowledge also respect whatever food that the patient would like to eat, and that's usually is prepared by either the family or something that that they would be able to have. With regards to our nurses as well as our nurses aide who helps with the bath, we are all not only licensed, but we also are our staff, especially our nurses aide, we also check their background check. We do a background check on them, and so all of them that's part of also our credibility of being able to take care of patients. So yes.
Like we are Gujarati, we live to eat.
So just if I could interject for a second, hospice does not provide the food. Food is generally prepared at home. Occasionally, the hospice volunteers such as myself could make a meal that is suitable, but generally the food itself is the responsibility of the family.
I think a way to maybe sum it up a little bit for you is that hospice is not a caregiving agency. We don't do the caregiving, we're a clinical service. But our social workers, our nurses, we will all help you to get the services that you do need. That you can always come to us for help. I talked a little bit about the social workers. They will help you for that. Hina has even offered to make food for Jane, clients of ours, because she knows what that is and deliver it. And our volunteers who are also criminally background checked, this is a lot of what they do. So while I can't promise you anything standing here, but if you were with us, we would be able to help you with all of those issues. Okay?
Just one comment. There is a program called as Meals on Meals. Meals on Meals. So that can be provided.
Any other questions?
Is there any psychiatric or psychologist are involved? Suppose the person is in an acute depression and having the suicidal tendency.
Oh, yes, yes. We pay very close attention, now in California with the Right to Die Act, That's a very big issue with us. We don't want anybody to feel like that. We want them to know that we can help them be pain-free. We can help them emotionally. Our doctors, we all sit down every week on Wednesday, including myself, and we all talk about every patient. It's called a case conference. And we all talk about every patient and what their needs are and what their changing needs are. And the social workers will assess for the psychological needs. And of course, we assess very specifically for suicidal ideation. Good? All right, anything else specific?
If somebody has ALS, they might live 6 months or they might live 2 years or 3 years. Do you provide any kind of services to those kind of patients?
Once somebody has been referred to us by the physician as estimating that they have 6 months or less to live, then we're there. Now, 6 months comes and your dad is still with us, that's fine. He just needs to have, and this is a clinical question that June can give you even more clarity on, but there just has to be some kind of decline, continual decline, to be able to stay on a hospice service. So it's not a, it's not a custodial. It's not custodial.
The benefits that they have the first benefit period, which is 3 months. So every benefit period, what happens is that they reevaluate the patient if the patient is still qualified for that. Meaning they still show that there is a decline, that they still meet that needs. So after the first benefit period, which is 3 months, they go into another second benefit period, which is another 3 months. After that, it's every 60 days benefit period. Now, once they see that the patient is stabilized really and he has really not shown any progression of the disease process, what they do is they take them off hospice so that they could use the rest of their benefit period when they need it most. That's when they actually, again, get a little better, but not, not continues to decline at that point. So they also do an IDT meeting every 2 weeks, and that every 2 weeks they evaluate the patient so that they can see whether the patient still qualifies for, whatever benefit period that they have.
And once maybe somebody's been determined to be more custodial and they might come off of the hospice service, there is something called palliative care, which we talked about a little earlier. And yes, and that's a step just before, it's very new actually in this world, and it's a step just before hospice. So you're not quite end of life, but you have some problems there. There's also home health if you have a skilled need. But again, once you're on the hospice service, you're going to know way in advance that maybe some date, whatever the date is, the social worker's going to talk to you, you're going to come off hospice service, what else can we move you to? They're not going to just come and take everything away and say, now you're on your own. They're going to help you transition to something else. And you can always come back.
Can I?
Yes. Yes.
Thank you. Morning. Let me walk you through, not taking away anything from the hospice part, and I will come to that too. We are all fine, walking, talking, moving at this point. 2 months later, somebody gets disease X, disease Y, disease Z. Your life expectancy is still good, 6 months, 2 years, 3 years, but as somebody said, where myself now, I don't have support at home, and yet I'm not expected to die within 6 months that the doctor, as a doctor I can say that you're not. So what happens at that point is you have 2 options, more, but at least 2 medically. We will say this is the treatment that you're going to get. You have limitations of doing those things, I can't drive for chemotherapy, I can't drive for my cardiac cath or bypass, what do I do afterwards, I'm by myself, etc., etc., etc. You can either choose to live in the hospital and the rehab, or you can choose to go in palliative care, who offers all those services. And just for the history, palliative care was developed in 2007, so it's only 12 years old. While hospice care is probably older than all of us. It has always been there. So there, that's one aspect. Now, supposing somebody is diagnosed with a terminal disease, again, is right, not expected to live for more than 6 months. That's where hospice care comes in. So the hospital can offer you that you can either register with hospice care or manage on your own. It's always good to go with hospice care. And I'll tell you, I'm sure a lot of you knew my dad. He passed away right here at my home, 4 miles away from here in 1998. He was under hospice care. He was diagnosed with terminal cancer and he chose not to go for any other further treatment. But he did need a special bed and oxygen. We had a visit from our end every week, etc. So you can choose. Now there is one other element that I haven't heard, and if you're okay, I'll mention. There is one requirement besides expectancy of life to be 6 months or less. You have to be DNR and DNI. What does that mean is, do not resuscitate, do not intubate, etc. The things that we normally can do for patients when you call 911, they will do those things. They do chest compression, intubation, etc. For hospice, from my understanding, it is, yeah, I understand, but that is a requirement, so you have to agree to that. Then only the hospice care will come in. Am I correct or not correct?
You're essentially correct. You don't have to sign up for hospice and say immediately you're DNR. You can choose life-saving measures, but the social worker is going to work with you about why it's important to get to the DNR status, because it's an awful thing to do to an elderly person, all of that. CPR, yeah.
So then now let's say you chose palliative care. Unfortunately, in 3 months, things went bad and things are going worse. You can at that point choose not to get any resuscitative measures and choose to move on to hospice care. If the time goes out, she explained what happens next. But palliative care, it's important. After 2 months, you're fine, walking, talking, moving, driving. You don't have to be on any care, you can be on your own back again. So that's the difference between hospice care and in palliative care. Hospice care, basically you are not expected to kind of move out. Although can you? Sure. Miracle happens, you can. Thank you.
Thank you so much.
Professor Ben just wants to add something.
I want to clarify one thing too, that once you go on a hospice, that does not necessarily mean that you have to be on hospice. Sometimes people change their mind.
Absolutely.
Yeah, and then they can ask for 911. And
Oh,
then at the
absolutely.
moment you're out. So
Yes, and you just have to say at one time, I want to go back to my doctor for treatment, and we're going to help you transition back to your doctor.
So once you join the hospice, does not necessarily mean that you have to be abiding 100%. So, people are scared. So I'm just letting you guys know that I think that there is a provision that you still have the right to do what you want to do.
Thank you so much. Yes. It's always your right to come and go. It's like I said early on, it's a never-ending benefit. It does not go away. All right, so I know we're moving pretty quick. I've covered a little bit about volunteers, choosing a hospice. We've talked a lot about that, but there's some questions you want to consider maybe when you're thinking about what hospice to choose. And I've just put a couple on here that are kind of like conversation starters. If you have any questions, you can ask any of us. I do want to talk just for a minute. I'm going to ask Vivian to talk for just a minute about aftercare, because it's important to know that once your loved one dies, everything changes. You've spent all this time being a caregiver and taking care of them, and now they're gone. What do you do? And so we're there for you for 13 months following the death of your loved one, if you want us to be. If you don't, we'll go away. But if you do want us there, we will be there, and we have some very specific tools and staff available to help you with that. So I'm going to let Vivian tell you a little bit about it, because she really is our expert in the administrative bereavement.
I have a quick question. Touching the volunteers, people feel that, I know that there are a few people here who wants to become hospice volunteer, and they are not very comfortable visiting the sick. So, would you touch the basis that there is so many other things they can do?
Yes, I would love to tell you that, because that's my area of expertise. Okay, Medicare recognizes two types of volunteering. Patient care and administrative is what they call it. So if you don't want to visit patients, that's perfect. You can work with us in the office. Vivian has lots of volunteers in the bereavement program with her. We do massive mailings. We create all these items for our patients. We have a crochet circle that Hina helps with. There's endless amounts of things you can do. We always say that if you have an hour to give, somebody needs it. And for everything that you do in the office, that means a nurse doesn't have to come and put together the materials that you have to sign on with, or all kinds of things that you can do in the office. So we would love to have you. Just see me, we have applications, and it's a terrific volunteer family that we have. Okay, Vivian.
Okay, so just really quickly, aftercare and bereavement, that is available to the patient's family and friends 13 months after the patient passes, if they choose. And that could be materials, it could be phone calls that are mailed out, or the calls are made out regularly. Volunteers are a big thing with that. We do prepare the mailings, we mail them, and we're very respectful of how the materials are prepared. Nothing is ever kind of just thrown together. It's done very respectfully. In addition to the mailings and phone calls, we do have bereavement support group meetings that are completely free of charge to the family, friends, and any community members. Those are regularly scheduled. Evergreen actually has 4, I believe right now, that it's open to the community. You don't have to have been with hospice. It's there for you to share your grief process and kind of see that you're not alone. Someone else experiences the same thing as you. In addition, we also have individual and group bereavement services that are available, completely free of charge.
We also have a veterans program.
Right, we have a veterans program. It is facilitated by a volunteer who was a veteran, because you and I can't kind of relate to them as somebody who was in the service. So we do have that. That could be spouses, the family members of veterans, anybody who has any association with the military.
We have volunteers that attend funerals for our patients, to represent us, all kinds of things. And our materials are also done in multiple languages.
Correct. Spanish, Korean, Tagalog, I believe also. Vietnamese, yes.
Vietnamese, exactly, yeah. So we're culturally sensitive to everyone. We want everyone to have the support in the best way they can receive it. So are there any more questions before we end? Oh, okay. We also have a memorial service once a year, and it's actually coming up at the end of this month. And we'll invite everybody who was on service with us, all their loved ones that were on service with us for the previous year. And it gives us a chance to honor them, to grieve with them, because we grieve too. And we have to go on to the next patient. We can't stop. So it gives us a chance to grieve, to light a candle in their memory, to gather together to talk about them. And it's a beautiful, beautiful service. Our lead chaplain is Ernesto Zamora, and he is very warm and welcoming, and puts together a beautiful, beautiful memorial service. So any more questions? Oh, sorry.
What will it take to convert or translate that into Hindi and or Gujarati?
Well, I'm glad you asked me that. All it would take is Hina. And while we were talking, I had that same idea. I'm going to go back I'm in the office. You're in the office on Monday. I'm in the office on Tuesday, and I'm going to mention that to our chaplain, that we have someone that can do that. We just had a staff member, I think, do the Korean, right? Yeah, a staff member just converted to Korean. So Hina, I know your next volunteer task.
In fact, if you ask right now, I'm sure there'll be some hands who will be happy to help with that.
Okay, well, let me know. We have applications right here. To become a hospice volunteer, you have to fill out an application. It looks like an employment application. Fill out a background approval form, because Medicare requires that we do background checks on everyone, and you can understand why. It's very, very important. And then we put it through the background, and then you will come in for 4 hours of training and orientation, and then we'll be ready to use your talents, whatever they are. Okay, any other questions? Anybody?
Other than the orientation for volunteers, what additional training they may require before they become a full-fledged volunteer?
Okay. We are mandated by Medicare to do continuing education. So when you come for your initial training, we're going to talk to you. Actually, Vivian's an expert in this. You want to go through briefly through the training?
At the training, we will discuss with you what the hospice philosophy is. You'll hear again about the Medicare regulations, the things that you can and cannot do as a volunteer, because volunteers cannot provide any kind of clinical care. We do go over HIPAA, so you can't share patient information with unauthorized people, of course, and there's a signing document section. At Evergreen, we do a lot of extended services for our patients, and you'll learn about what those are and how you can get involved with those things. Any other questions?
Yeah, I think
4 hours. 4 hours of training and orientation. You only have to do it one time, but then through the year, you're going to get materials from us that are continuing education. And we're required by law to be sure that we talk to you about the privacy requirements every year, so that you understand clearly about privacy. We offer you the TB test free of charge. You'll have a minor physical free of charge. There's a lot of benefits.
Here, I got another question.
Yeah.
No fingerprints. No fingerprints. Background.
Background check, yes.
Yeah. No credit check. just
Can you give her the mic, please?
One second, sir, one second.
in India we have different languages, but Hindi is our national language, so at least we should have some materials available in our language, which is Hindi.
He was in charge.
For those of us that were born abroad, especially in Asia, we all had vaccinations for tuberculosis and whole bunch of diseases. So when you take the test, what happens?
Medicare requires that all volunteers are tested for TB once a year. And if you have already done the immunization for it, you just have a one-time chest x-ray. So you only have to do it one time.
We want to be respectful of the time. We'll take one more question before we wrap it up. And Judy, June, and Vivian will be here. We can talk to them one-on-one and basically take as much time as you need to ask any questions you have. हिंदी में आपको अगर सहायता चाहिए तो हम हैं, प्रफुल्ला बेन है, आपको हेल्प करेंगे, ठीक है? राजल बेन?
Yeah, my question is that it's just suggestion. So many people are turning towards vegan food or vegetarian food right now. So is it possible, like even in the hospitals or even in the nursing homes, the quality of the vegetarian food is just plain rice or plain vegetables or...
Rajalben, I couldn't possibly agree with you more. Food is always a challenge, especially for Jains, especially for vegans. Unfortunately, that is beyond the scope of hospice. Hospice, as far as I understand it, does not have control over that. With that, we'll conclude here. I know we are going to do a raffle And before doing the raffle, just make sure you all have a raffle ticket. And before I lose you right after the raffle, I just want to take a moment to thank a few people, starting with the Jain Center Board of Directors, the Executive Committee, and Dr. Modi. Thank you so much. AD support, Narendra Uncle Maniar, thank you. My husband, Nitin Dhami, I have to go home with him, so I have to kind of make sure I thank him, and he does a lot of work. Pradeep Pai, who is filming us, hopefully you're making us about 20 pounds lighter on the camera.
I did a special camera.
Ramila bin Shah, for the food, facilities people, Samir Bhai Shah, Kima Modi, the PR team, and I'm very sure I'm forgetting a few people. And last but not least, the Evergreen Hospice Care, Judy, Fassett, June, and Vivian Tran. Thank you so much for taking the time from your weekends and spending half a morning with us. It's sincerely appreciated. Now we can do the raffle. And right after the raffle, for those of you who have not won and those of you who have won, be sure to stop by at Prafula Ben's booth and grab a few goodies for you, okay? As a memento of gratitude for coming here.
Judge, thank you very much for coming today. I think this is a very timely topic. After the lunch, we will have another similar type of a topic which is related to the healthcare issues, and at 1:30 we're going to have a demonstration of an acupuncture that relieves the pain in non-medical way. So please stick around, come in, and that will be, today is a healthcare day, and we're going to make sure that all of you are healthy. Any vegan related question or the food related question, I will be happy to talk to you on a one-on-one basis. Thank you very much.
Should we do the raffle?